Welcome back to Out and About. In this part of the programme, we take you to the Houses of Parliament to bring you highlights of the 2025 Global Health Awards.
Good evening, my lord, my lady, distinguished, honoured guests, right honourable sir, ladies and gentlemen. A very warm welcome to the Global Health Awards 2025. It is a privilege to have you with us this evening as we honour excellence in healthcare, innovation, leadership and public service. Without further ado, I am delighted to introduce our first speaker for the evening, Mr. L. George, Chairman of the Global Health Awards and Managing Director of Luminary Networks Limited.
Thank you, Kashmira. Good evening, members of Parliament, my Lord, Lady, and distinguished guests. It is a true honor to welcome you all to the inaugural Global Health Awards 2025, an event dedicated to celebrating extraordinary achievements in advancing health and well-being around the globe. Whether you have joined us from the UK or travel from abroad, thank you for being a part of this special evening. Tonight, we gather not only to recognize excellence, but to honor the spirit of innovation, compassion, and resilience that drives global health forward. These awards represent more than professional accomplishments. They symbolize lives improved, inequalities, addresses, and futures transformed. Together, we can create a world where everyone has the opportunity to live a healthy and dignified life. Welcome once again, and let us begin the celebration of global health excellence. Thank you.
This event came about when I saw there are a lot of Asians, or rather Indians, involved in this industry. Indians are doing very well in the healthcare industry, and there are recognitions happening around for people generally from the community, but not specifically from Asian community. So I thought it was a good idea to recognize people from our community and bring them forward. There are a lot of Indian doctors present today. From various different industries. There are doctors who have traveled from India as well. Some famous cardiologists travel from India. So in a whole, this particular event is basically to recognize people from the healthcare industry.
It's a real honor, first of all, to be asked to give a keynote lecture at the Global Health Awards in the Houses of Parliament in the members' dining room. Such a beautiful historical place. And really, for me, the most important thing really is just to give people my perspective on where we are in terms of healthcare and what we need to do moving forward. I think, unfortunately, looking back over the last few years, I think we can learn from mistakes of how we could have handled the COVID pandemic better. I think certainly lockdowns, when we look back, were not the right approach. We should have had focused protection for the elderly. I think that the COVID vaccine rollout was a huge mistake to so many people. At best, it should have maybe just been given to high-risk people. And of course, now independent analysis of the data is showing lots of serious harms from the COVID vaccine. But I think these are all downstream symptoms of what I've been speaking about for over a decade, is that we have the corporate capture of medicine and public health. And until that is addressed head-on, we aren't going to make any inroads into improving the NHS in terms of quality of care and improving population health.
Ancient wisdom teaches us that evil is rooted in ignorance. As Stephen Hawking alluded to, the greatest enemy of knowledge is not ignorance, it's the illusion of knowledge. In other words, the greatest barrier to the truth is psychological, not intellectual. Two of those major psychological barriers have become most prevalent at an individual, population, and institutional level over the last 5 years.
since the world was turned upside down during the COVID pandemic. The first of these we can all relate to, the emotional phenomenon of fear. In a state of fear, it impedes one's ability to engage in critical thinking, and simultaneously makes us more compliant to authoritarian rule. For example, leaked WhatsApp messages published on the front page of the Daily Telegraph revealed, as regards to COVID, the Secretary of State's plan, Matt Hancock, was to, in quotes, frighten the pants off the public.
Good evening, everyone. It's a wonderful event, and I hope you are enjoying it. Distinguished guests and esteemed friends, let me start by congratulating Mr. Ligi George of Luminary Network Limited for celebrating excellence, innovation, and leadership across the global health landscape. These prestigious awards recognize individuals, organizations, and initiatives making transformative contributions to healthcare system, advancing equity, and improving access to care around the world. It's my pleasure to be here tonight. It's a wonderful event, and George is doing a great job. He's recognizing a lot of people who have done good work in healthcare. And more than that, I'm very pleased that he's supporting the work of the Lumba Foundation. The Lumba Foundation is tonight launching a project for 2,000 widows to be trained as general duty assistants in India. And he's fully supporting it. I'm very, very pleased.
Ladies and gentlemen, the first award for the evening is for Hospital of the Year, and it goes to Cleveland Clinic London. The second award for the evening is for Surgeon of the Year, and it goes to Dr. Chinmay Gupte. And the next award for the evening is Outstanding Achievement in Community Outreach, and it goes to Parkinson Center for Integrated Therapy. So the next award for the evening is for Excellence in Community Medicine, and it goes to Dr. Dominique McConnell. The Nurse of the Year, and it goes to Ms. Vanessa Sturt. The next award for the evening is for General Practitioner of the Year, and it goes to Dr. Deepan Patel. The next award for the evening is for Home Care Provider of the Year, and it goes to Om Care Group. The next award for the evening is for Excellence in Medical Oncology and Cancer Care, and it goes to Dr. P.S. Dattatreya.
The pride, the pleasure, the privilege, and the prestige to be a part of this august gathering and to get this Global Healthcare Award is entirely mine. I am honored, and it's actually a privilege beyond imagination that I am here to get an award for excellence in oncology and cancer care. It's really beyond my bounds, which I can't express. Thanks a ton.
The next award for the evening is for Public Health Champion Award India, and it goes to Rekit Detol Banega Swasth India campaign. Okay, the next award for the evening is for Global Healthcare Icon in Cardiac Sciences, and it goes to Dr. B. Durga Prasad Reddy.
I feel overwhelmed coming here, and it's a very nice event, I feel, and I'm also very grateful to the city who have selected me to get this award. Thanks a lot.
The next award for the evening is for Community Impact Award India, and it goes to Reckitt, Campaign for Self-Care for New Mums and Kids Under 5. Excellence in Public Health Communication. And it goes to Dr. Aseem Malhotra. The final award for the evening, which of course rightfully is the Lifetime Achievement Award. And it goes to the Right Honourable Lord Darzi OMKBE. Unfortunately, Lord Darzi couldn't be with us this evening due to an urgent commitment he had to attend, and he has sent his apologies.
Yes, he sends his apologies because he had commitments. He did inform us earlier. So unfortunately, he couldn't be here, and he sends his apologies to everybody.
Well, a huge congratulations to all of the awardees and of course the team behind the event. That's all we've got time for in this week's programme, but we're back on your screens again next weekend. So until then, take care, bye-bye.